Pregnancy is a time of joy and anticipation, but it can also come with challenges. One such challenge is pre-eclampsia, a condition that affects some expectant mothers. Pre-eclampsia is a serious complication that typically arises after 20 weeks of pregnancy or even shortly after delivery. It is characterized by high blood pressure or hypertension and protein in the urine, known as proteinuria, indicating kidney involvement. Pre-eclampsia can affect various organs, including the liver, kidneys, and brain. It can range in severity from mild to severe and, if left untreated, can lead to serious complications for both mother and baby. The exact cause of pre-eclampsia remains unknown, but researchers believe it may be linked to abnormal development and function of the placenta, the organ that nourishes the growing fetus. Recognizing the symptoms of pre-eclampsia and seeking timely medical attention are crucial for effective management. Understanding the condition, its risk factors, and treatment options empowers expectant mothers to make informed decisions about their health and their baby's well-being. Pre-eclampsia can develop gradually or appear suddenly, making it essential for expectant mothers to be aware of its symptoms. Early detection is key to preventing serious complications. Common symptoms include a persistent headache that doesn't go away with over-the-counter pain relievers, changes in vision such as blurred vision, flashing lights, or sensitivity to light, and sudden swelling in the face, hands, or feet that's more than typical pregnancy swelling. Other warning signs include nausea or vomiting, particularly after 20 weeks of pregnancy, pain in the upper right abdomen or shoulder, and shortness of breath, indicating fluid in the lungs. It's important to note that some women with pre-eclampsia may not experience any noticeable symptoms, which is why regular prenatal checkups and blood pressure monitoring are vital. If you experience any of these symptoms, even if you're unsure, it's crucial to contact your healthcare provider immediately. Early diagnosis and treatment are essential for managing pre-eclampsia and preventing it from progressing to a more serious condition called eclampsia. Eclampsia is a rare but life-threatening complication of pre-eclampsia characterized by seizures or convulsions. It occurs when untreated pre-eclampsia progresses and affects the brain. Seizures associated with eclampsia can be prolonged and can lead to coma, permanent brain damage, or even death for both mother and baby. The symptoms of eclampsia are similar to those of severe pre-eclampsia but also include seizures. These seizures can occur without warning, even in women who haven't experienced severe pre-eclampsia symptoms. Prompt medical attention is critical if you or someone you know experiences a seizure during pregnancy or shortly after childbirth. Eclampsia is a preventable condition with timely diagnosis and management of pre-eclampsia. Regular prenatal care, monitoring for symptoms, and adhering to your healthcare provider's recommendations are crucial for a healthy pregnancy and safe delivery. Certain factors increase a woman's likelihood of developing pre-eclampsia. Understanding these can help identify women needing closer monitoring. Common risk factors include a history of pre-eclampsia, chronic hypertension or high blood pressure before pregnancy, and being pregnant for the first time. Other factors include carrying twins or triplets, being over 35 or under 20, having a family history of pre-eclampsia, and certain medical conditions like diabetes or lupus. Discuss these risk factors with your healthcare provider. They can monitor you closely and minimize your risk. Section 5. Diagnosing pre-eclampsia. Tests and monitoring. Diagnosing pre-eclampsia involves a combination of monitoring blood pressure, testing for protein in the urine, and assessing for other symptoms. During your prenatal appointments, your healthcare provider will regularly check your blood pressure. A blood pressure reading of 140 over 90 millimeters of mercury or higher on 2 separate occasions, at least 4 hours apart, is considered high and may indicate pre-eclampsia. In addition to blood pressure monitoring, your urine will be tested for protein at each prenatal visit. Protein in the urine, also known as proteinuria, is another hallmark of pre-eclampsia. Your healthcare provider may also order blood tests to assess liver and kidney function, platelet count, and other factors that can be affected by pre-eclampsia. If pre-eclampsia is suspected, your healthcare provider may recommend additional tests, such as an ultrasound to monitor the baby's growth and check the amount of amniotic fluid, or a non-stress test to assess the baby's heart rate and movement. Section 6. Managing preeclampsia treatment options. The goal is to prevent progression to eclampsia and severe complications. Treatment varies by severity and pregnancy stage. Mild cases may require monitoring, bed rest, and lifestyle changes. Medication may be needed to lower blood pressure. Severe cases often require hospitalization. Intravenous medications prevent seizures. Ultimately, delivery is the definitive treatment. Section 7. The importance of prenatal care in early detection. Regular prenatal care is crucial for all expectant mothers, but it's especially vital for early detection and management of conditions like preeclampsia. Attending all scheduled prenatal appointments allows your healthcare provider to monitor your blood pressure, check for protein in your urine, and assess your overall health and the baby's development. During these visits, don't hesitate to ask questions, express any concerns you may have, and report any unusual symptoms. Early detection of preeclampsia can make a significant difference in preventing complications. Your proactive involvement in your prenatal care is essential for a healthy pregnancy. Remember, prenatal care is not just about monitoring your baby's growth. It's about safeguarding your well-being throughout your pregnancy journey. Section 8. Medications used in preeclampsia management. Medications play a crucial role in managing preeclampsia and preventing complications. Antihypertensive medications are used to lower blood pressure and reduce the risk of stroke. Commonly used antihypertensives include labetalol, nifedipine, and hydralazine. Magnesium sulfate is another essential medication used in preeclampsia management, primarily to prevent seizures. Magnesium sulfate is administered intravenously and requires careful monitoring as it can have side effects. Corticosteroids, such as betamethasone or dexamethasone, may be given to women with severe preeclampsia before 34 weeks of gestation to accelerate the baby's lung maturity in case early delivery becomes necessary. These medications, along with close monitoring and supportive care, help manage preeclampsia and improve outcomes for both mother and baby. Section 9. Delivery, the definitive treatment for preeclampsia. While medications and close monitoring play a vital role in managing preeclampsia, the definitive treatment is delivery of the baby and placenta. The timing of delivery depends on the severity of the condition and how far along the pregnancy is. If preeclampsia develops close to term, 37 weeks or later, and the baby is doing well, your healthcare provider may recommend inducing labor or performing a cesarean section to deliver the baby promptly. However, if preeclampsia develops earlier in pregnancy and the baby is not yet mature enough for delivery, your healthcare provider will aim to manage the condition and prolong the pregnancy for as long as safely possible to allow the baby more time to develop. In such cases, delivery may be necessary if the preeclampsia worsens or if the baby shows signs of distress. The decision to deliver is made carefully, considering the risks and benefits for both mother and baby. Section 10. Long-term implications of preeclampsia. While most women recover fully from preeclampsia after delivery, some may experience long-term health implications. Preeclampsia increases the risk of developing cardiovascular disease later in life, including high blood pressure, heart attack, and stroke. Women who have had preeclampsia are also at a higher risk of developing kidney disease and other health problems. It's crucial for women who have had preeclampsia to be aware of these risks and adopt a healthy lifestyle to minimize them. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, and managing blood pressure and cholesterol levels. Regular checkups with your healthcare provider are essential for monitoring your health and addressing any potential issues early on. Section 11. Staying informed and proactive. Your key to a healthy pregnancy. Pregnancy should be a time of joy and anticipation, and by understanding the potential complications that can arise, expectant mothers can approach this journey with knowledge and confidence. Preeclampsia, though serious, is manageable and often preventable with early detection and proper care. Remember, regular prenatal appointments, open communication with your healthcare provider, and being aware of your body and any unusual symptoms are crucial for a healthy pregnancy. By staying informed and proactive, you can significantly reduce your risk of complications and enjoy a safe and fulfilling pregnancy journey. Trust your instincts, advocate for your health, and embrace the miracle of bringing a new life into the world.